Hi everyone, welcome back to SG Dr. Wellness. After completing the HIV series, I will now touch upon some other common sexually transmitted diseases. Today, I'll be sharing more about gonorrhea. What causes gonorrhea? What are the symptoms? And how is it tested and treated? If you're new to our channel, click on the subscribe button now. Gonorrhea is a well-known sexually transmitted infection. It is caused by the bacteria Neisseria Gonorrohoeae, and it is commonly known as the clap. This bacteria is mainly found in the discharge from the penis and in the vaginal fluid of infected individuals. They can then be transmitted from person to person through unprotected vaginal, oral, or anal sex, or through sharing of vibrators or other sexual toys that have not been washed or covered with a new condom each time they are used. The bacteria can cause infection of the male and female reproductive and urinary system, and less commonly the throat or the eyes. In serious cases, it can even spread within the patient's bloodstream, resulting in a condition known as disseminated gonococcal infection, where the bacteria can infect distant sites of the body like the skin, the joints, even the heart or the brain. The infection can also be passed from a pregnant woman to her baby, and without treatment, gonorrhea can cause permanent blindness in a newborn baby. The bacteria cannot survive outside the human body for long and is not spread through kissing, hugging, toilet seats, or sharing of bathrooms, towels, cups, plates, or cutlery. Gonorrhea is a tricky bacteria. It can infect you and yet cause no symptoms. 10% of men and 50% of women do not show symptoms. And when you do, typical gonorrhea infection symptoms in men includes painful or burning sensation when peeing, thick yellowish discharge from the penis, even painful swollen testicles. In females, the symptoms tend to be milder. They can also have a burning or painful sensation when peeing, increased vaginal discharge, increase or vaginal bleedings in between their periods. Rectal infections in both genders may result in anal itching and discharge, soreness, bleeding, and painful bowel movements. If you suspect that you may have gonorrhea, please get yourself tested. Diagnosis can be obtained easily by either 1. Doing a swab test and sending it for microscopy and culture, or collecting your urine and sending it for a PCR testing. Blood tests are not helpful in making a diagnosis. In my practice, I would also advise to screen for other sexually transmitted infections like chlamydia, syphilis, HIV, and hepatitis B and C. I would share more on these other STDs in future videos, so stay tuned. Once the diagnosis is confirmed, treatment would involve the usage of antibiotics to kill the gonorrhea bacteria. We can either use an injectable form of antibiotics or oral form, or even a combination. Abstinence from sex is usually advised until you have been told you no longer have the infection. You should also repeat the tests after treatment to ensure that you have already been cleared of the infection. Take note that you may catch the infection again despite recovering from the previous infection. Remember that gonorrhea treatment is never just about yourself. Your sexual partner or partners should go through testings to make sure that they are not infected as well. And this will help prevent reinfection to yourself. Patients at risk of gonorrhea infection includes those who engage in promiscuous sexual activity and those who do not use barrier methods of contraceptions such as condoms. When left untreated, gonorrhea can cause complications and long-term medical issues. In females, the gonorrhea bacteria may spread up the female reproductive organs to the uterus and ovaries, resulting in a serious condition called pelvic inflammatory disease. Acutely, they can experience lower abdominal pain, fever, and even pain during sexual intercourse. In the long run, they may even experience long-term pelvic pain, infertility, and even increased risk of ectopic pregnancy. And if you unfortunately catch the infection during pregnancy, gonorrhea can cause an increased risk of miscarriage, premature labor and birth, infant eye infection, and possibly blindness of the child. In men, gonorrhea may spread to the testicles and prostate, resulting in reduced fertility in some cases, and like I've mentioned above, in less than 5% of cases, the gonorrhea bacteria may even spread into the bloodstream and cause life-threatening infection in other parts of the body. Therefore, seek early medical attention. Gonorrhea can be treated and complete recovery is expected in most cases. Thanks for staying till the end. Please subscribe, like and share. Stay tuned for the next episode on chlamydia. Until the next time, stay safe, stay healthy.